it's Mrs. Lewicki, and I'm going to talk to you about the nursing process. The nursing process we use all the time in nursing. You'll hear nurses, experienced nurses, say we never use it, but it is part of what we do almost every day. It's part of our decision making. We'll talk about the plan of care in a separate video, but what the nursing process is, or who uses it rather, is it's used by nursing to communicate consistent information about clients. It uses its own nursing language. What it is it uses the problem-solving method to determine actual or potential problems. It helps to meet the client needs. It's specific nursing interventions, and we use it to evaluate outcomes and evaluate whether or not we're making any progress with the care. Other things to know about the nursing process is it is dynamic and it's patient-centered. Now, the nursing process has a lot of phases, and in the phases, it goes from, we sometimes call it ADPI. So we start with assessment. We're going to gather information, and I'm going to talk about each of these phases. But we gather data through assessment. We make our nursing diagnoses. We create outcomes, or the PI part of it is planning. So we plan for how do we meet the problems. We implement, and those are our nursing interventions to help correct the problem, and then we evaluate whether or not that's worked. Now, all of these, it's a dynamic process, so if I've made an implementation, I'm going to go back and assess. And have I assessed, did it meet the outcome? I'm going to evaluate, and then I'm going to say, well, I don't need that diagnosis anymore, or maybe I do. Now, we're going to talk about assessment first. So assessment is the systematic, it's systematic. It's either current or ongoing issues. We use it to predict health risks, to identify any health problems. Where it's continuous through all phases, like I pointed out in the diagram, of the nursing process. It focuses on patient response. So are they responding to what we do? If they have pain, which we're going to do an example here in just a minute, but if they have pain, are they responding to the things I did? Repositioning, a warm blanket, an ice pack. Did it elevating, rest? Did those things help with the pain? The data that we collect can be subjective, objective, or retrieved from the medical records. And we'll talk about that in just a minute with an example. We take the assessment findings and we cluster our data. There are different ways that we cluster data. One of those is Gordon's functional patterns, and what Gordon looks at is basically their ability to perform the task independently, independent of care, and how do we get them back to their prior level. Roy's adaptation model is a physiological model, and that's so Roy categorizes the data in physiological methods. Body systems, so we look at different systems, nervous system, cardiac system, to cluster our data, or sometimes it's just clustering of data. So all of these things, neuro changes and musculoskeletal changes might be clustered in one section. So we're going to talk about a patient. So before we talk about diagnosis. So our patient is Paula Petunia. And Paula is 45 years old, and she had surgery. Now, I don't know what kind of surgery she had, but she had surgery. She's complaining of pain after surgery. The nurse performs a pain assessment and determines that the pain is incisional. It's where the incision was, and is worse when she moves. She describes it as sharp, continuous, and rates it out as a 7 out of 10. She says that her pain is better when she's not moving, and she moves better after pain medication has been given. She was given 2 tablets of Percocet 3 hours ago and has been receiving it every 6 hours. You notice that she grimaces when she is repositioning herself in bed and guarding her incision when you are assessing it. Now, what I want you to do is pause the video and determine which of the assessment is subjective, which is objective, and which is from the medical record. So I want you to look at that. When we talk about diagnosis, this is a nursing diagnosis. And what we do in the nursing diagnosis is we cluster our data. So every problem that a patient has or presents with is not going to fall under one nursing diagnosis. So when we talked about Paula, everything I told you was about her pain so that we could focus on one nursing diagnosis. But people have other problems. They could have hypertension, they could have irregular heart rate, they could be dehydrated and have pain. So we want to look at all of those things and cluster them as they go. We want to determine the appropriate nursing diagnoses, and those are very specific, and you're going to find them in Appendix A. You make your nursing diagnosis after your assessment. Be sure to review. For you, I want you in your textbook, there's different terms that modify the diagnosis, and I want you to look those up. I didn't write all those down. It's different from medical diagnosis. What makes it different? First of all, you don't use a medical diagnosis in a nursing diagnosis. We are not licensed as nurses, as an entry-level nurse, to make medical diagnoses. Advanced practice nurses can, physicians can, PAs can, but we as nurses do not have that scope of practice. So the other thing is that they're problem-focused, they're risk-related, they can provide health promotion or be related to a syndrome. So there are three components of a nursing diagnosis, and most of the time we call it a three-part statement. So you're going to get your diagnostic label, and that you're going to find based on their symptoms, and I'll show you how to use this book in just a minute, but there's a list of approved nursing diagnoses. I did want to show you how to use the Nurse's Pocket Guide. So when we're doing our case study on Paula, I just want to show you how you go about using this book. Now I pointed out at the end, there's a handy dandy reference with a list of approved nursing diagnoses. Also, in your textbook, I believe it's Appendix A, has the nursing diagnoses. But what I want to show you is you kind of start with, I always start with the pages in the back that are tabbed. So these are medical diagnoses that can lead you to your nursing diagnoses. So in our case of Paula, in this edition of the book, I'm looking at page 1083 and looking at post-operative recovery period. Now, the only information you were provided had to do with pain for her. So we're going to look up acute pain. So I see on page 1083 it says acute pain may be related to disruption of skin tissue and muscle integrity, and it says more things. But I'm just telling you that surgery is a disruption in the skin tissue and muscle tissue. So then I go to the index in the back and I find pain, and pain is located on pages acute pain 633 to 639. So I mark that to make it easier for me when I was doing this lecture. And I find that there's a lot of descriptions about pain. So what the definition is, what it can be related to. So when I'm looking at doing a three-part nursing diagnosis, I want to make sure she meets that related to factor. And so I've got the definition related to biological injury such as infection, or physical injury such as trauma or an operative procedure, which is what she had. And there's some defining characteristics. This is where your as evidenced by would come from. Then as you go on down the page, you can see here's defining the desired outcomes or evaluation. So that helps you to write your goal. And as you go on the next page, there's some more of those. And then there's the nursing priorities or the assessments and interventions. So you want to find the one that matches what she had done, which is surgery, so the surgical one. You want to make sure you find out what that is. And then you're going to, the rationale will be embedded within this, and it provides you with interventions and rationale. Thank you. The problem, the NANDA that we discovered, the nursing diagnosis. So what can the nurse do to help the patient meet the goal? How can I make that pain not be a 7? What can I do as the nurse? How can I help her so she's not guarding? What kind of things can I do, pharmacological and non-pharmacological? So those kind of things can include things that you delegate, things that you assess or evaluate, like breath sounds, which doesn't matter for pain, but breath sounds or lab values or things like that. What can we do to prevent any complications? What can we do to reduce risks? What kind of teaching can we do? And what kind of physical care? They should be patient-centered, and specific with a concise action. Realistic and relevant. Nursing students need to know why we're performing the interventions, and we call that rationale. So, evaluation. So it occurs to measure the desired outcome. So if my desired goal was that which should all relate to what that evidence is, all relate back. So if my desired goal is for Paula to not have pain at a 7 out of 10, that's what I'm measuring. How do I measure that? I reevaluate. I assess. Paula, what is your pain? When does it hurt? Is it better? Is it worse? Tell me. And it's always based on the goals. And then the nurse determines it was met, it was not met, or, and if it was met, do we continue it? Is what we were doing, did it work? Is she still having pain, but whatever I did, it worked to make her last 6 hours instead of 3? What kind of things? So did I meet it? Did I not meet it? And do I need to modify it? Is it done? Okay, she's not having any pain anymore, so I can discontinue it. So then do I continue that? Do I discontinue it, or do I modify? All right, that's it. You're going to get to practice now.